I'm so excited to have everybody here today. It's really awesome to see all of your faces. This is something that's been in the works for a little bit. And just kind of before we get started and jump in, I know that maybe some of us have been on a lot of calls today or maybe rushed to get here in time. So let's just take a second to just land here in this virtual reality. You could put your feet on the ground, maybe stretch a little bit. We'll do some more movement in part two. But yeah, just kind of land here and tune your mind in. I know that I've been struggling at times to stay focused on a lot of video calls. So it's absolutely fine if you've got to get up and step away or whatever you need to do during this call. But I just wanted to share first a little bit about the Nature Lab, which is an initiative at the sanctuary, which is, even though we are being distant right now, is still actually building its permanent home. They're under constructing, converting a building that will become a permanent nature lab, which is going to be committed to urban ecology and citizen science, which feels ever needed and really timely given everything that is going on right now. So we're really excited about that. And the Health Autonomy Clinic is an initiative that came out of Nature Lab, which kind of merged with some work we were doing out here in New Lebanon, where Frank and I and Eileen also live. We had been organizing health workshops and skill shares, and trying to bring people together who had skills to teach other people and really create a network of health practitioners. And we even have a small clinic space here where we're able to see people. We have a community apothecary. And so Eileen, beyond being just a neighbor and a really good friend, is an amazing participant in that group. And so we were really excited because she's been like cranking out mass and has an amazing backstory to it. So we thought that today we'll first do a little bit about how Eileen got involved in this work. And then in part two, we're going to actually see the step-by-step process of how the mass making works. So for this part, just for the sake of time, we'll have questions kind of in between these two sections. But if you've like a burning question that makes sense to ask in the moment, raise your hand and we can unmute you and you can ask. Sorry? Oh, and one last thing. So we've been recording these workshops so that folks who aren't able to attend can watch them afterward. So it is being recorded. If you prefer your video not to be recorded, in that recording, you can just turn off your video for the rest of the call. Yeah, great. So Eileen, I would love to pass it over to you. And maybe you can just like first share a little bit about yourself and kind of like what it's like to be first and foremost like a frontline nurse during this whole pandemic.
Yeah, so I got involved in the mask making because pretty much as soon as this started to hit the United States, I ended up getting quarantined. At my hospital, they really were not, protecting us the way they should have. And this is really true of hospitals across the country. I mean, none of them were prepared for this. And of course, our government system didn't help. We've been really just vastly underprepared. So what happened, I was taking care of a patient with respiratory symptoms. They had already started getting rid of masks on the floors because they knew that it was going to be an issue. So they were only allowing masks to be worn when a patient was confirmed positive with coronavirus. So I was taking care of this patient. They had no idea. They were not expecting that he would have coronavirus. And I didn't even know that he was being tested until I went back to the floor the next day. No one notified me. And I ended up waiting 5 days for them to confirm that he had coronavirus. In the meantime, I had 3 more shifts during that, working with patients on my own floor, because I had floated that night, working with patients on my own floor. And I called my administrators and said, you know, what should I be doing? Are you going to send me home? I just want to make sure you don't forget about me, because I don't really work on that floor most of the time. And I basically got, oh, you can wear a mask if you want to. You don't have to, you know, the patient hasn't been confirmed yet. And so I'm working my shifts, and whenever an administrator would come around, they would ask me why I was wearing a mask, and I would tell them, and they would say, well, we don't want to worry the patients. You should really take that off. You shouldn't be wearing a mask. You know, you don't know that you were exposed. The test hasn't come back yet. And then 5 days later, the patient came back positive, and I was quarantined for another 10 days. But that was when I just felt helpless being at home, not doing anything, not able to participate, not able to take care of patients. So I started looking around for something that I could do, and I found a couple of groups that were newly formed. And this was, at that point, it was about March 14th or so. And these groups were just then forming. There's the Community Care Planning Group of Columbia County. They're a mutual aid network that was just getting off the ground. And they started to break down into smaller groups. And one of those groups was a mask making group. So I and 2 or 3 other people got involved with that and started trying to really get the word out for that and get more people involved. And so we are now the Mighty Masketeers of Columbia County. We have over 150 people involved on our Facebook group. We have dedicated cutters. We have dedicated sewers. Sewists. We decided to call them sewists because sewers is spelled the same as sewers. So we have dedicated cutters, we have dedicated sewists, we have one woman who has basically donated her house as our supply warehouse. We have another person who's basically donated their house as our finished masks warehouse. We have at least 7 or 8 drivers who literally just take orders for supplies and drive them from our warehouse to one of our sewers or cutters. And then they will pick up finished masks. They will run to Joann's or Lowe's or wherever we need and pick up supplies for us. We have, it's an amazing system that, you know, it's only April 21st. So we've really only been together for 4 or 5 weeks now. And we have this whole system. It's basically like an industry just up and down Columbia County. And we have been sending masks. We've sent masks down to Brooklyn, to a dedicated COVID hospital down there. We have 2 different masks that we do. Tonight we're going to be doing our citizen mask, and we also have a medical mask. So we've been sending both of those masks down to Brooklyn. The medical masks are being used by frontline healthcare workers down there, and our citizen masks, they're handing our citizen masks out to people who are taking care of COVID patients at home. We have sent masks to Joseph's House in Troy, some local nursing homes, Dollar General, ShopRite, anybody who needs them. We've been trying to send them out. And we also, at this point, what we're really working heavily on is we got an order from Taconic Women's Prison for 300 masks for the women who were incarcerated there. So that's our main focus right now. Yeah, that's my story.
That's absolutely amazing. I mean, just like knowing you and seeing how this whole thing has evolved. Yeah, I see people giving you snaps. One question that I have is, like, I guess zooming out a little bit beyond your this network that has formed, like, why is it that healthcare workers right now do not have the protection that they need? And then I want to circle back to those networks, but I feel like that's a really important question that a lot of people have? Like, that seems like a crazy thing, but can you give us a little bit more context about why there's this huge lack of protective gear?
Well, yeah, there are a lot of answers to that question, starting with the fact that, our president completely dismantled the pandemic response team a couple years, I think. I don't quote me, I'm not positive, but dismantled the pandemic response team long before this whole thing happened. So there was no one to respond to this crisis, and everyone could see, starting at the end of January, when we knew that this was going to be coming over here, that it's been dismissed. It's been dismissed by our president. It's been dismissed by our governmental agencies. And there's just been a scramble to respond and no help available. So as community members, we had to take matters into our own hands. We need to be able to protect each other and our healthcare workers, because we don't have adequate equipment to take care of these people.
Thanks for answering that. I guess I'm also curious, like how, like for example, the Taconic Women's Prison or Joseph's House, like how is this happening that your people are finding you and finding this network since you haven't been around that long?
It's really been the hard work and dedication of our members. So we have members, like I said, from all up and down Columbia County, and all of them have their own, networks. Everybody knows somebody. So we have members who know nurses at Columbia Memorial Hospital. We have members who know travel nurses who have been traveling down to the city. One of our travel nurses one of our members knew a travel nurse who was able to get us this connection at the hospital in Brooklyn, and was able to contact the administration and show them our tutorial. Because at that point, she didn't have any masks to show them. She showed them our tutorial, and they accepted the masks just based on the tutorial and the materials that we were using. We've also been connecting with other mask making groups. There's one that's based up in Greenwich. They're just everywhere. They're all over the country. They're all small, just like us. But we share all of the information that we can. We share our existence with each other, and mostly it's been a lot of just word of mouth, getting the information out that we are here. We launched a website on Sunday. So, because it was really hard. I know a lot of people struggle with Facebook, and up until this point, I had been off of Facebook for years, and it's a very cumbersome way of communicating as far as I'm concerned. So we do have our Facebook group, which is, it's a private group, anyone can join, but just to get the word out there more and spread it around, make it easier for people to find us, we have our website now. And yeah, really, it's just been spreading the information through our little whatever channels that we can.
That's great. Would you want to maybe take a few questions before we go on to the tutorial part, or are there things that you would want to share? Anything that we didn't talk about the network that you want to mention?
It looks like Eileen has something that she wants to ask.
I have a question about masks for children. Do you make masks for children, or maybe for shelters?
We do have, so the tutorial that we're going to do tonight, there is a child size on that mask. So the one that we're going to be making is 9 inches by 6 inches, but the child size is 7.5 by 5. And then I'll also post, we have another tutorial for the medical masks, which are, they're a little bit more fitted. They're a little rounded over the nose. And that actually has 4 different sizes. There's an adult, adult large, and adults medium. And then there's a child large and a child small.
Okay.
The answer is yes, there are child.
Okay.
As well.
And then I think go ahead.
Oh, I was just going to say the only other thing I wanted to mention was I just wanted to kind of promote the shirt that I'm wearing. That just came in the mail today. I'm very excited about it. There was an artist down in Asheville, North Carolina, who was involved, who had asked one of his neighbors for a mask. And they brought one, and as a gift to the mask making group, he created this image, which is very Rosie the Riveter-esque. Her name is Mindy the Mask Maker. And she really has been a force behind this to really just galvanize all of the mask making groups across the country. And so I'm sorry, very distracting. I've got a 16-month-old in the background. So the company that he works for has started producing different merchandise with this logo on it, and all of the proceeds that they from this are going to local mask making groups. So any group who wants to reach out to them can go to their website and email them, and they're putting special coupon codes up on their shop so that people can go purchase the merchandise and make sure that the money goes to their local mask making group, not just the mask making effort as a whole. So that was really exciting to us as well, that we can now use that money to buy more supplies.
Great. I think Bria also had, I know you had your hand up earlier, Bria.
I was actually going to ask you to explain how to raise hands, but then Eileen showed you can just do this.
Great. Eileen, I was also going to ask one thing. Does anybody else have their hand up? Linda, is that you?
Yes.
Okay.
Eileen, if you could just give us your website that you said that you just got set up.
Does everyone know how to access the chat in Zoom?
Yes.
Down at the bottom of the screen, you just hit the chat box.
Yes.
I say that because James is already on it. So that is our website there.
Whoops.
And if you haven't already accessed the chat, you won't be able to see that. So anybody who hasn't opened the chat box yet, just let us know and we'll repost it again.
Great.
It's columbiamasketeersny.org.
Is anybody having trouble seeing that? No.
It was so fast. It just came up and left.
Oh, okay. I can also send it again. Let's see.
Columbia.
I was just going to ask you, Eileen, if you could explain a little bit about how you chose the design that you did for the masks. And, you know, there's so many YouTube videos and Instagram videos and tutorials popping up all over the place. I think people have a lot of questions about, like, well, it should be designed with this material, or why is it that shape? So can you just speak to a little bit about where this design came from, and like why fabric masks too?
Sure, yeah. I mean, the why fabric masks is really, we as lay people, community members don't really have access to the types of materials that commercially made masks are made from. So that's really why fabric masks. The two tutorials that I have tweaked a little bit are both mask designs that have been accepted by other hospitals that have been really hard hit by coronavirus. I will say that most of the hospitals around us, most local hospitals, are not accepting masks, homemade masks for their workers, because most of them have at least some amount of protective equipment, and anything that is commercially made is going to be better for people who are dealing with coronavirus patients on a daily basis. You know, none of these masks are going to be able to replace an N95 mask, but if you can wear one of these masks to protect your N95 mask, you know, because most most healthcare workers are being asked to use the same N95 mask day after day, put it in a paper bag. Sometimes they're getting sterilized in between uses, but for the most part, they just really need the protection there. And again, the reason that I chose these tutorials in particular are that they, in the hospitals where there really is absolutely no protective equipment left, there are hospitals that are accepting both of these designs. And the one that is more fitted is really, it's as close to an N95 mask pretty much as we can get with the materials that we have on hand. And then the other one, the one we're doing tonight, is more of a citizen mask. It's a surgical type mask. It's got the 3 pleats. It's just a rectangle. And that is really the best way to protect everyone. Is the more people who wear masks out in public, the better, because for really you're not wearing this mask so much to protect yourself as you are using it to protect everyone around you. The more people who are wearing masks, the less people's droplets are going to be out in the air, because they're finding that so much of the transmission is through asymptomatic people.
Great, thank you. I know a bunch of people joined kind of midway through. I just want to say welcome, everybody. Thanks for coming in. Eileen just gave an overview of how the mask makers got started and what they've been up to. Does anybody have any questions before we start transitioning into the actual tutorial part of how to make the mask? And you can just raise your hand if you do have any questions. No? All right. All right, Eileen. She's got this crazy double camera setup that I'm really impressed by. So we're going to be able to get up close and personal with all of the mask making gear. Thanks, Eileen.
I'll just share with you really quickly the ridiculous hacker thing that my husband did so that we could have an extra camera. And we just took our extra webcam and stuck it up on a broomstick, and it seems to work pretty well. So let me just switch to that camera and we'll get started.
Eileen, just really quick before you get started, I'm just going to quickly share my screen, because you might have seen on the webpage, I think that Julie might even be holding it up. Amazing. Beautiful, yes. That's the guide that we're going to be following. It was on the event page, and I'm going to quickly share my screen so that you can see this beautiful guide that Eileen has created for us. So.
And JJ is the one who made it beautiful.
Okay. So let's see if this is going to work. Great. Can everybody see this, my screen? Or can you give me a thumbs up if you can see my screen?
Yes.
Great. So feel free, if you want, for this second part, if you want to follow along and see the steps that Eileen is talking about, but we'll be sure to send this out again in the chat. But in this guide, it tells you all about the backstory. And if you scroll down, it tells you the materials that you need. And then it gives you step-by-steps with the pictures here, but we're gonna get even better live version with Eileen right now. But I just wanna let you know that resource is available and it's shareable. So feel free to use it for yourself or send it to other people that you think would be interested. All right.
All right. I am just gonna move over so I can see myself doing this, because otherwise I'm not gonna be able to. I'm gonna end up with, here we go, let's see. Now, why can't I see myself? Hang on, I'm sorry, hang on 1 second. I'm gonna have to go back to the grid. Okay, well, hopefully if anybody has any trouble seeing what I'm doing, please just unmute yourself and holler out, because I can just barely see my little grid there. It won't let me look at myself, unfortunately.
It looks great from our view.
Okay.
People should go to speaker view.
Yeah, even when I go to speaker view, it doesn't change it because I'm the person who's speaking.
Right. Oh, right. But everybody else, it would be wise to go to speaker view. You'd be able to see it best.
Yes, absolutely. Thank you. I'm sorry. All right. So what you're going to start with, and I already have pre-cut here, is 9 by 6 rectangle of your main material, which is going to be the outside of your mask, your back material, and it's really important, especially if you're making these for other people, to have 2 different materials so people can remember which side goes to their face and which side faces out.
Is it possible we could, I'm sorry, I'm Monica Miller. I'm from the Sage College. Is it possible we could record this tutorial? I press record, but it says I have to ask permission from the host.
Great, I'm so glad that you asked that. We are recording it, so we'll post it on the Sanctuary's YouTube once it's finished. Thank you for mentioning that.
Okay, thank you.
Okay, so the last thing that you're going to need, so you've got your two different fabrics. 100% cotton is really important for both of these fabrics. They need to be pre-washed so that they don't end up shrinking when people wash them. And also, what really works well, we found the best thing for these masks is actually high thread count sheets. If you have, they don't have to be unused. They have to be clean, but you know, if you have sheets that have a tear in them or something like that, the high thread count material is really helpful for filtering the smaller particles. But quilting material works as well. And then for the inside, you're going to have a 3rd layer that is some kind of filter material. So right now, I've been making so many masks. The only thing that I have left is this surgical drape material, which in these masks, we have really found that it's a little bit too thick for the masks that we're using. So in the tutorial, there are links to all of the different things that you can use. And I will actually post in the chat, we have a list of interfacings that you can use.
Eileen, what would you say is like the easiest to find like interfacing fabric or what you're mentioning?
Unfortunately, because so many people are making these masks, it's getting harder and harder to find any of the interfacings. One thing that I've been using that I've found works really well and is still readily available, but is a little bit more expensive, are furnace filters that you can get from Lowe's or Home Depot. They come, the material is accordioned and it has some metal mesh on it, and it comes in like a cardboard frame. So what you would do is you would get that. I've been getting ones that are about 20 inches by 30 inches, and the accordion is about 1 inch wide. And you can take off the cardboard, take off the mesh, and then you have this nice sheet of filter material that's already, it's got a high filtration. The best thing that you can do is get like MERV 13 or higher, or if you go to Home Depot, they have their own filtration scale. It's FPR 10 is the best that you can get.
You may want to check into that though, because some filters have fiberglass or metals or other problems with them that they're not meant to be for breathing through.
Right, and the ones that I'm talking about are made out of polyester. Most of the ones that you can get at Home Depot or Lowe's are polyester. But yeah, you don't want to use any of the ones that say that they have a metal or are, just make sure that what you're getting is the spun polyester kind. And the nice thing about those is they're already very high filtration, because that's what they're being used for to begin with, their home air filter material.
Great, thanks.
So like I said, you need your filter material. So the first thing that you're going to do is you're going to make sure that you have your 2 pieces of material right sides facing. So the right side of your one material is facing the right side of your other. And for this, I'm going to use ties. I have this Grow Brain ribbon that I'm going to use. There are many different options you can use. So for ear loops, if you have elastic, 1/8 to 1/4 inch elastic works really well. And if you're going to make loops around your ears, they need to be 7 inches long. Or you can also, another thing we've been finding that works really well and saves your ears, because it does get irritating after a while wearing these masks for a long time, is you can use two 13-inch pieces of elastic and crisscross them. So you would make an X like this, and we're gonna pin them to the corners here. And then when you turn your mask right side out, it will go, you know, they'll crisscross on the back of your head, and it's a little bit more comfortable that way. But for this one, I'm just gonna use the ribbon, and you're gonna try, you're gonna pin the ribbon. Still working this out here. About 3/8 of an inch from the top edge of your material. And you're going to place the pin in from the outside edge to the inside edge so that you can, or to the inside so that you can easily pull them out when you're sewing. So I'm just going to pin those on there really quick. And if you were doing the ear loops, you would just be pinning the one end of the elastic to the top of the side, and then you would take the elastic and bring it down and pin it to the bottom edge as well. So now I've got all of my ties all set, and then I'm going to put the other side of my material on top and make a little sandwich. And then the last thing I'm going to put on top is my filter material. And then this whole thing, I'm just going to pin it around the edges to make it easier to sew. If any of this is difficult to see, let me know, and or if I'm going too fast, I can always slow down. I tend to speed up when I get nervous.
The view looks great.
All right, and then when you sew this shut, you're going to start about 2.5 to 3 inches from and you're going to start on the bottom edge, 2.5 to 3 inches from the edge. And hopefully this isn't going to be too noisy. This is one thing I'm not sure about. And you start forward and then back up a little bit, and then head forward again, just to lock that seam so nothing rips out when you try and turn it. So then you'd sew all the way to the corner, turn, sew over your tie, and back up a little bit just to secure it. And then you're going to do that all the way around the edge of the mask. But I already have one prepared, so I'm not going to go through that entire process with you. So this is my prepared one. I started down in the bottom corner and went all the way around the edge. And now I'm going to turn, I'm going to clip the corners, makes it much, much easier to turn. I'm just going to take and snip the very edges off. Make sure that you don't cut your sewing line. And then I'm going to turn this right side out. And with this mask, I actually used the long pieces of elastic to make the crisscross in the back. And it takes a little bit of work to get those corners nice and crisp when you're turning it right side out. So there you go. And at this point, I don't have room on my table for an iron, but at this point, to make it a little bit easier, you would just iron all the way around so it's nice and flat. And so this is the front of my mask, and this is the back with my crisscrossed elastic. And another thing that you can add, but is not necessary, is a nose piece to stabilize it. So at the top, you'll have at the bridge of your nose, in a traditional, you know, a manufactured mask, there's a small piece of metal that goes across the bridge of your nose to secure it to your nose and make for a tighter fit. So what I've been using for that is a paper clip. That is, I'm sorry, I'm going in the wrong direction. There we go. A paper clip that is straightened out. So I'll straighten this out. And then in order to prevent it from going through the fabric, you can turn up the ends with a paper clip this size. This is a pretty long one. It's about 5 inches long, I would say. You can turn up a pretty hefty amount of it just to keep it from going through the fabric. So there's one end. And there's the other. So you've got this nice straight piece of metal, well, straight-ish piece of metal that has the turned up ends. And this would be where you would want to sew that in. So you would put it in the opening at the bottom of your mask and place it up along the top edge. And then just pin it in place. And then you would just sew right underneath it about a ½ inch from the edge, just to secure it in place. And you could also sew down at the ends just so it won't slide back and forth in that channel at the top. Another alternative that one of our members has found a little easier is, instead of putting your ties or your loops in at the beginning, you can just put your 3 pieces of material together. So I have everything here, just the material, and then sew across the top and the bottom, and it makes it a little bit easier to turn. So you sort of have this tube of material instead, and then you can press the edges in this way and then just sew down, and you can place your elastic right in that and pin it, and you can do that on both sides. It makes it just a little bit easier, and you would be able to put your nose piece in at the same time here. Was that clear to everybody? It's something we've added very recently, so it's not in the tutorial. I will add that, and the tutorial that you have a link to is a living document, so it will, if I make any edits to it, it will show up whenever you open that tutorial. You won't have to get like a separate download for that. Okay, so once you have all that together, you're going to make the pleats for your mask. We're actually almost done at this point. It is a pretty quick mask. So you're going to start from the top, and you're going to make these accordion pleats, and I'm hoping that you're going to be able to see this pretty well. So you're going to fold down, fold the bottom half of the mask up, and then fold it down. So you have this little accordion pleat, and you're going to pin that. And you're going to need 3 of these in the mask. It's very important to have all 3. The top one helps to form it over your nose, and the bottom one really helps to cup it under your chin so that you get a good tight fit. And so I won't go so that's how you do it. I won't go around and do every one of them because once again, I have, whoops, that's the wrong one. I have one that's already been pinned all the way around. So you can see that the pleats, you want to make sure that you have the pleats nice and even on both sides so that your mask is a nice rectangle. And then you'll also, so you'll still have this spot where you turned your mask open. And you can just fold down the seam allowance on both sides and just pin that. And then all you'll need to do is sew one line all the way around. You can start from any corner. You're going to sew right over your pleats, taking out your pins as you go, and then down across the bottom, making sure that you close up that spot where you turned. And then up the other side, taking out your pins as you go, and then across the top, and you are all set. That's your finished mask. And when you're all done, it looks just like this. And I will switch cameras again so that you can see me put it on. So this is your finished mask. And that took a little bit less time than I thought it would. So I had everything all prepared ahead of time.
Wow, thank you. I give some snaps for that. Well, as you were buzzing through that, a few questions came up with the chat. So maybe I can just share them with you and we can go through each question. The first
that sounds perfect.
What type of sewing machine that you had?
Oh, my sewing machine, let me take this down so we can, let's see, duct taped it too well. Okay, so I'm gonna try and show what I've got here. I have to switch cameras again. So this is actually a machine that I borrowed from someone. It's a Singer Talent, and it works really well. It's very simple. You don't need any kind of a special machine for this. I actually work upstairs usually on my 1947 Singer Red Eye, which is a behemoth and has no special features whatsoever. All it does is sew a straight line, but it is a workhorse. And that's really all you need is something that can sew a straight line. And honestly, you don't even need a sewing machine in order to do this. Let me just switch back because I don't know what to do with this camera now. We actually have several members of our group, our children. We have 3 children who sew basically full-time for us. They are doing it out of the kindness of their hearts. They're also sending out these beautiful hand-drawn cards with all of our masks. So anytime we package up a bunch of masks and send them out, we have these kids are doing that. And they are actually sewing all of their masks by hand. They're just sewing a straight line because that's all it is, like I said, sewing a straight line. And they're doing them by hand and they're doing a fantastic job. They're just beautiful.
That's amazing. How old are these kids?
Between the ages of 8 and 11.
Wow.
There are a few teenagers who are sewing on machines as well.
So cool. Well, that kind of is actually a good segue into the next question somebody had was, what if you don't have a sewing machine or maybe don't know how to sew? Do you have any tips for how to make a mask?
So we don't have it up on our website yet, but we have someone who has actually taken on a project of making no-sew masks because we can get them really quickly out to the community. They're not as fitted as these masks. They don't have a filter in them. They are just literally 2 pieces of, 2 layers of fabric. I think it's 1 piece of fabric. I'm not actually involved in that project. But we will have the instructions for that up on our website soon. And we have sent out at least 200 of those masks to people around the Bliss Tower community in Hudson, just so that we could get them something very quickly. And they're just a single piece of fabric and a couple of hair elastics. So that is an option for people. And like I said, I will try and get that up on our website pretty quickly.
Great, thank you for that. The other question was actually what type of thread, like the thread that you're using in your machine, is there a certain like thickness or type of thread that you need for these masks?
Just plain quilting, or, you know, plain quilting thread. You can use, a lot of our members are using 100% cotton thread. You can use polyester, mostly because all of our fabric is pre-shrunk, so there shouldn't be any issue with that, with like shrinkage, with using the polyester thread and the cotton material.
Okay, great. The other question was about the pleats. When you make the pleats, do they fold up, like towards the top of the mask, or do they fold down?
So yeah, that is an important question. They actually do fold down. So, oh, that's right. We have to do it this way. So this is the top of the mask, and you want your pleats all pointing down.
Great. Oh, that's helpful. And then let's see. Julie had a question. Is the filter mandatory? Because in the pattern document, it says if you're using it.
It's not mandatory. All of the masks that we have been creating, we have been fortunate enough to have a lot of different filter materials. When we first started, we were using just a plain 100% cotton woven flannel as our lining of our masks. We have gotten a lot of the non-woven interfacing. Many of our, Joanne's has donated some. Many of our members have been sourcing it from wherever they can find it and donating it to us. But it's helpful to have a 3-layer mask. And there's also another tutorial out there for making a mask with a pocket so that you can place a filter in that. I don't have the link for that one, but just the more layers is better up to a point. You know, you still need to be able to breathe through it, but the 3-layer mask really is the best. And the best thing to have inside is a non-woven material. Because if you imagine, you know, weaving, you've got the fibers that go this way and the fibers that go this way, and you're always going to have gaps between those fibers. And the non-woven material really helps to stop those small particles that we're trying to prevent from going through.
Great. There's another question. If somebody has a knitted mask, how could you install or attach a filter inside to an existing mask?
A knitted mask, like someone has knitted a mask, or one that's made out of knitted material, like a t-shirt?
Let's see. Do you ask?
Yes, it's made out of 100% cotton. It's actually knitted. I have it if I could show you it if you want.
Yeah, I'd love to see it.
Okay.
Anybody have another question while we're waiting?
Bria wanted to show a mask that has ties instead of elastics.
Okay.
Yeah, I really liked how you showed the simplicity of this, but can you maybe do me full screen, or do I do it? Share screen. I want to show what I'm doing. JJ, can you make me the speaker view?
No.
Yeah, so each person individually chooses whether they're looking at it as a gallery or as the speaker view. And
right, but I'm speaking and I'm not getting my picture on screen.
Right. Everyone else will be able to see you. This is the problem I was having at the beginning. I couldn't make myself on my own.
I was unable to find elastic. So I substituted bias tape. It looks more complicated than it is. It's the same process, but you showed sewing just the top and bottom and then stitching the sides. Instead, for this, inside out, you stitch the 2 sides, put it right side out, These are unfinished edges that are then covered by the bias tape. So you do about 36 inches of bias tape. And if you don't happen to have this, I stocked up a lot from yard sales and estate sales. You can do any like 1.5 inch strip of fabric, fold it in half, run it along and do a zigzag stitch so that it doesn't come apart.
That's great. That's a great tip.
You can just tie it. It's a little messier getting it on because you have to tie, but it's easier to sew and you don't need the elastic.
Great. Thank you for showing that.
Do we have that knitted mask now?
Yes. I don't know if you can see it right.
Oh, that is tough to see. Oh, I see. Yeah. So that mask is really not be providing you any protection at all. I mean, you can see right through the.
I thought so. Yeah.
Yeah.
And
it's
there's
cute,
nothing.
but it's not going to be providing any protection at all.
You get fashion points though.
And
Yeah.
there's nothing that you can attach inside to protect yourself either, right?
Not easily, I don't think. You could try putting some kind of interfacing. There is fusible interfacing that you could possibly iron to the back of it. And I do have in that, it's pretty far back in the chat now, but I did post a list of interfacings that work really well for this. And some of those are fusible. So if you want to look at that, it specifies on the document which ones are fusible and which ones are not.
Thank you.
Mm-hmm.
I just resent the document that that Eileen was talking about to the chat, and then Chris said, I've seen ties made from t-shirt fabric. If you cut lengthwise 1 inch by 15-inch strips, then pull it, it will curl and does not require any stitching.
Yeah, Chris, I've seen that too. Thank you for bringing that up. And you can use that the same way you use the elastic too. You can either make it crisscross in the back, you can use it as ear loops, or you can also use it as ties. You know, you can do you can cut out like 4 20-inch long pieces and use them as ties.
Great. Does anybody else have any other questions that they want to ask Eileen about the process or the mask itself? Bria?
I have another comment in that for interfacing, it's best to not use the iron-on because it has all sorts of chemicals in it, that if you use the sew-in, it doesn't have as many chemicals.
Great, thank you. Does anybody else have any questions about the tutorial?
Looks like Elizabeth joined late. I can see that she just put that in the chat. So JJ will post that link again to the mask that we made tonight.
Yeah, I can send it right now, EP.
And JJ, if you wanted to post the link to the other mask as well, for anybody who is interested in a slightly more fitted mask that is a little bit more complicated to sew, this is the mask that we're giving to healthcare workers. Actually, I don't think JJ has it readily available. I do have it. Hang on one second.
Okay, thanks, Eileen.
You didn't have it?
No, the one they're using for hospitals. And after you pull that up and send it, Branda said she'd like to hear more about organizing strategies. How did so many people so quickly break down the multiple tasks and hop in? And kind of what advice that you would have if people wanted to start this in another place like Troy. How did you get organized? How do people communicate? How do you become a member? So if you could talk a little bit about this network, how it formed, and how do people plug in, that would be great.
So our organizing really happened very fluidly, very organically. You know, the main hub happened, I got involved in the community care planning group maybe a week or so after they started organizing. And they basically just, the main organizers for that page really just sort of created multiple Facebook groups off of that group, and sort of just trusted that people would fall into their own group. So they just started out with a very basic main, we're a mutual aid organization. We want to help our community, but we're not sure, you know, we don't have the infrastructure to organize it all right now. So we're basically looking for members who want to take a leading role in various things. So that went on for a couple of days, and as people joined, they all had ideas about what needed to happen. So they started breaking down into groups. We had a group that was just trying to figure out how to distribute food. We had another group who was interested in getting people connected with unemployment and other, you know, options there. Helping people get insurance as they reopened the insurance marketplaces for this. Then there were the mask making groups, and just sort of broke down, and people sort of found their niche as they broke down into smaller groups. People sort of trickled down following the groups and took leading roles. I'm usually a person who kind of sits in the background and works quietly and does my own thing, but just joining this so early, I found myself, I had become a leader very, very quickly, and didn't really mean to do that. But so really it's just letting people know that you're there, you know. If there's something that you want to do, Facebook really is a great place to start. Just creating a group and then putting it out there and letting people know where you are, who you are, and what it is you want to do, and just recruiting people to help you.
That's great. Can you talk to, I think one of the really interesting parts of the network is that you don't have to be a great sewer. You don't even have to have a sewing machine. Can you talk about, like, I know you mentioned at the beginning, but like how there's people who are doing all types of tasks, not just sewing masks, and maybe just name a few of those and how it works?
Yeah, so we have a lot of different people. We have, and I can't speak to exactly how these people fell into our group. I think it was just, there's a lot of people out there right now looking for a way to help. You know, a lot of people who are out of work and find themselves just drawn to helping some kind of cause. They feel kind of helpless sitting at home and wondering what they can do. I'm sorry. Can you repeat the question? I've got my toddler walking along and she completely distracted me.
She's very cute, so I understand that. No, I was just saying, like, one thing is that it's interesting that there's a lot of people in the network who aren't necessarily, you don't have to have a sewing machine or.
Oh, right. Okay, I'm sorry.
Yeah, no, just about how people can plug in with very small tasks.
Yeah, so we have people who are just, unbending paper clips for the nose pieces. We have people who are just disassembling HEPA filters and sending the material from the HEPA filters on to our main warehouse. We have people who are just driving materials around Columbia County. We have someone who is just organizing the drivers. They're making the spreadsheets and they're taking the orders from our workers for supplies. They're taking orders for finished masks. There is going to be a place for you no matter what it is that you want to do in any of these groups. There's definitely a place to plug in. On our website alone, we've broken our website down pretty well to show people what options they have for us. So we have, we've got a page, we've got a form to fill out if you want to donate materials or gift cards to Lowe's, Home Depot, Joann's. We have a form to fill out if you want to be a driver. We have a form to fill out if you just want to cut. We have a form to fill out if you want to be a mask maker in any of the ways that that entails, whether it is cutting material, unbending paper clips, taking apart filters, if you want to sew, if you want to cut and sew. We really try to accommodate everybody. We actually have kits made up now so that if you want to just jump right in, you can email, actually, I think you fill out the form. You can fill out the form and we'll have a driver bring you out a kit of the pieces for 20 masks. And you can just, everything's all cut out for you. It's all set. You just sew them and send them back. So we've really tried to make it as user-friendly as possible and sort of a plug and play sort of a deal.
Thanks. And how do you all, one of the other questions Brenda had, it was in the chat, was how do you make decisions collectively, like being one, only knowing each other virtually and online? How do decisions get made?
That's kind of the most difficult part about this whole thing, is organizing remotely. We have a lot of Zoom meetings. We started out with an hour-long Zoom meeting every day at noon for several weeks, just organizing, figuring out how to get this whole thing off the ground. We try to have the input of everyone. We make it as democratic as possible, so anybody who shows up to the meeting is welcome to speak. We are finally down to meeting only 5 days a week, and 3 of those days are for just general questions, and then 2 of them are for just supply issues, and like, you know, the questions of what's the best filter to use, what happens if I run out of elastic, what's the best wire to use for the nose pieces, that kind of thing. So we do that Tuesday and Thursday, and then the Monday, Wednesday, Friday we meet for the real organizing. What do we want to put on the website, who's going to do the blog posts this week, that kind of thing. So it really is, it's intense. It's an intense process, but we have so many dedicated people. And that's the thing, there are so many of us that we don't all have to be on those meetings every day. Yeah.
Do you have any tips for people who are like, whoa, I want to set something like this up? Or do you have any tips or lessons learned that you'd want to share?
You definitely need a couple of people. So if you can find even just one other co-organizer to get yourself started, you know, let people know on social media that this is what you want to start and this is what you're interested in. And there are people all over who are interested in starting these things and getting involved. So like I said, ours really happened very organically, just more and more people, and people really through this have taken, people who usually don't take a leading role, and just be as open as you can, really, is the advice that I would have. Be open to everybody's suggestions, because that is how I ended up here. You know, we have 2 amazing organizers. I'm sort of secondary organizing. We have 2 amazing women who are really co-leading this, who have been just so welcoming and open to ideas. And yeah, really, it's hard to do it by yourself. Finding a couple of other people is really helpful to get things started.
Do you see the other questions? Looks like Africans asked.
Yeah, I was trying to read them as I was talking.
Yeah, I can tell them to you if it's easier. He said, what is the email to order the kits for the 20 masks that you mentioned? How would somebody get connected to that?
So it's actually not an email, it's a form on our website. So if you go to our website, columbiamasketeersny.org, and click on, I can't remember what I titled the page, give me just 1 second. If you click on Get Involved, that is our involvement page, and you can click on I want to make masks. There's a button that says I want to make masks, and it'll bring you to a form. and it'll ask you what it is that you want to do, what kind of mask you want to make, and how you want to get involved. If you want to only cut masks, only sew masks, cut and sew, and then someone will be in touch with you, and they'll be able to get you the kit that you need.
Do you want me to share the screen of the site, or you want people can just look it up on their own?
Oh no, you can share the screen of the site. That would be great, actually.
I'll just show you.
Actually, if you just wanted to, I know you didn't plan this, but if you wanted to just give people a really quick little like overview of the site, and just kind of go through it really quickly.
Sure. Actually, am I unmuted? Yeah.
And at this point, I feel I need very much to mention how our logo came about. Our 9-year-olds all sent me ideas for our logo. They were very cute. They were all crayon drawings of what they thought our logo should be, and I did my best to honor all of their designs. So we have our rainbow mask with a little flower, and the ear loops are a heart.
That's amazing. I didn't know the story behind it. That's great. Wow, I'm so curious about these young kids who have gotten involved and how it's impacted them. So if you can see my mouse right here, if you click up here to where it says get involved, it says I want to help. You can say I want to make masks, I can drive, I can contribute materials. So for example, if you want to make masks, you would click that. And it sends you to this Google form where you can put in your contact information and your email and your address. So if I understand this, Eileen, you just submit this and then somebody gets in contact with you from the network.
Right.
That's great. Wow.
Actually, we do have a woman now who just last week or the week before decided that she would be our dedicated welcome person. So she will, if you become a member through Facebook, if you fill out the form, she will be the one who contacts you. She'll send you all of the information, and she really, I mean, she's just so warm. It's amazing. She makes everybody feel like family.
Great, thanks. So Brandon already asked, how do places know about you so they can place orders? Sounds like, yeah, so I guess how have, like you said it earlier, it's been through word of mouth and somebody knows somebody who knows somebody. But I would really like to know like what the impact has been, for example, at Joseph's house or at the prisons, like when you've donated masks, what has been the feedback that you've received and what has that been like?
Everyone has just been so grateful. We actually have not fulfilled our order at the prison yet because they wanted all 300 masks at the same time. So we're still working on getting all those masks together to send them. But Joseph's house sent us a beautiful letter. We've been sending them, they actually ordered 400 masks from us, and we've been fulfilling that like 25 to 30 masks at a time. So we got a beautiful letter from them just thanking us for our support. And right now, so we do have a request masks page on our website, but right now we've taken our request form down just because we have so many orders. We're basically trying to fulfill orders of a couple thousand masks at this point with the number of places that have requested them. So we do have a newsletter that you can sign up for. And once we are able to start taking orders again, we will get that back up, and we will let you know through the newsletter that we are taking requests again. I mean, we are still taking, we have one woman who has tried to dedicate herself to taking like small community orders, like 1 or 2 masks at a time. So there is a place on there's a contact form on our website where you can contact us for small orders. And really, it's really only one woman who's doing that right now. So we're trying to limit that as much as possible because I don't want to overwhelm her. But yeah, so if you do want to stay involved and stay in contact, you can sign up for the newsletter, and we'll let you know when we're taking larger requests again.
Great, thanks. Well, maybe for the next 5 minutes, we can open it up for questions. If you have a question, you could raise your hand and I can unmute you and we can just spend the next few minutes just asking any questions that have come up. Any questions? Bria.
Where can people buy? Oh, I'm sorry.
Go ahead, Eileen.
Where people buy sewing machines? I've been checking on Amazon, which is the devil, but I think it's the only way that I can get a sewing machine now, at least a small one.
Joann's actually has a really good selection of sewing machines, and they are doing curbside pickup, so you can order it online and pick it up at your nearest Joann's store. I don't have a specific sewing machine that I would recommend.
Thank you.
Bria?
What are some tips you have for things that people should not do or should be careful about? Because it sounds like you've done an amazing number of masks. What have you learned along the way?
So some of the things that we've learned are you want to make sure that your mask fits pretty well, fits pretty tightly. So, you know, if you make our adult mask and you find that it's not quite tight enough, you definitely want to either tighten the elastics or, you know, maybe go back around and make your seam allowance a little bit bigger. And for the fitted masks too, the same thing. You want to find one that fits you really well, because you don't want the air coming around the edges of the mask. You really want to be breathing through the mask. Other things that we've learned along the way. We've learned that the surgical wrap material really doesn't work all that well for these masks. It's a little bit too stiff for this application. Definitely making sure that if you are buying the furnace filters, that you're getting the ones that are polyester. There are filters that are what's the word that there are ones, like you said, that have metal in them. There are ones that have fiberglass. You definitely don't want to be using the fiberglass ones. And also something that I didn't realize existed, there are a lot of filters that have activated charcoal in them. And while they're not detrimental, they're really not helpful. All the charcoal does is take away odors. So you definitely do not need the charcoal filters. Vacuum bags, we've found, are pretty difficult to breathe through. They are usable and they filter well, but as far as breathability, they're not very good. I think that's about it right now that I have.
I did have a question. So the mask that you just made, how often do you, you put it on, you walk through the day, or walk in Walmart, you shop, and how often do you clean it, and how do you clean that?
So the masks are pretty much good to be worn for about 12 hours, as long as you're not touching the front. Once you touch the front of your mask, it is soiled and you need to take it off. And there are a couple of ways of going about cleaning them. You don't necessarily have to wash them if you have several of them, because they can be, if you have a safe place to put them and just leave them for a while. If you have 4 masks, you can wear one each day. And by the time you get back to the first one, it will have been time sterilized. Just because coronavirus only lives for a certain amount of time. And they're pretty much finding that 72 hours on an inorganic surface is enough to kill them. So when your mask has sat at home by itself for 3 days, you don't necessarily have to wash it. But if you are going to be wearing the same mask day after day, you want to wash it every evening. We found that everything that we've suggested on the tutorial is washable, is machine washable. You don't want to bleach them. You just want to use a lot of hot water and soap. And most people really are washing them by hand and just letting them air dry overnight.
Eileen, Chris had a question. Any hints about masks that work with eyeglasses not steaming up and not competing with side pieces on ears? That's a good one.
I have actually been okay with the mask that we made in this tutorial. I think it has a lot to do with the fact that most of the mask is cotton and breathable, that really doesn't fog up my glasses. But if I had to choose, I would definitely wear the fitted mask, because the surgical mask does sort of get underneath the middle of my glasses. So the fitted mask really, it kind of goes across the side of your face, and then it goes up a little bit over the nose and then back down. So that one works really well for me. I wear that one. I'm not allowed to wear a cloth mask at my hospital while I'm on my shift. But I do walk into the building with it so that I can get up to my floor and put on the surgical mask that they allow me to wear, which I keep in a paper bag.
Looks like EP has a question. Have you heard of people using Scott Blue towels for a filter? And if so, does it do anything?
I have heard that it is effective, but you can't wash it. Great. And I believe there is scientific evidence to back up that it is a good filtration medium. So that's great. It's just, you won't be able to wash it.
Eileen, just quick, yeah, how is maybe all this, like, becoming involved in this, and kind of your experiences at the hospital, like, affected you or impacted you, or kind of what are your thoughts, like, moving forward in all this?
That's a big question. That's a very broad question. It's affected me. I'm just amazed at the community that has come out of this. I mean, our group, so the community care planning group itself, which formed about 6 weeks ago, now has over 600 members. And our Masketeers community has over 150, and we only formed about 4 or 5 weeks ago. And it's just amazing how dedicated these people are. They're spending hours and hours upon hours each day, just trying to make our community better, while our hospitals are still scrambling to figure out what best practices are. You know, at the hospital that I work at, our protocols are changing on a daily basis, and they really don't reflect what best practices are, what's safe, and just the fact that we have such an amazing community that is really banding together in the absence of any organized response to this pandemic.
Brenda, is that a hand?
Well, just following up on that question, you know, I mean, this is part of this Health Autonomy Clinic that started in Troy, that JJ and Frank, have had a vision about, and connecting your group, you know, in Troy with this new science center. What do you think is going to be the importance of health autonomy as we move into the future? What are we seeing now in what's happening with this COVID and pandemic that's guiding us towards knowing we need to have more autonomy as we move forward?
Well, I think the biggest thing is that we absolutely need to have more health autonomy, more community response, more mutual aid work, because our institutions are failing us. The government has failed to protect us. Our hospitals are failing to protect us. Our, it's all well and good that insurance companies are paying for COVID, but what about all of the people? There are so many thousands, hundreds of thousands of people who don't have insurance, and they're being left behind. Really, the only way that we're going to be able to get through this and to build any kind of reasonable future is to protect each other. We're really all we have. We need to build these, we need to build this community infrastructure and protect each other, because no one else has our best interests at heart.
Thank you so much, Eileen, and everybody for being here. It's been, just, give you a big virtual hug, and thank you, one, for all your work in setting this up and showing up and making masks. I know that you're not only working in the hospital, taking care of older family members, the cutest baby maybe on earth, and all these other people, and to the fact of this like ripple effect, and the fact that an 8-year-old is drawing the design of this mask and is being able to be involved in this, and that you're holding so much of that. So thank you just for being here with us and passing along. I've had this mask kit and I felt really intimidated because I don't have the best sewing skills, and I feel like you really have made it felt very accessible. So thank you for that. So I'm gonna pass it off to Frank just to give some little updates about upcoming things. Eileen, I don't know if you want to say any last things or if there's anything that you didn't get to say.
No, just I'll plug us again. Just give our give our new website a look. My friend Mark and I worked really hard on it over the last week to get it up just as quickly as we could. So it's ColumbiaMasketeersNY.org. Check it out.
Thank you.
And just a couple of things. Thanks to everyone for coming. And our next, I guess one thing will be to sign up if you want to get our emails. We send out maybe like once a week kind of emails about upcoming events. We'll share the form in the chat as well as a follow-up. Just be kind of up to date on upcoming events that we're doing. Also on the 5th of May, we're going to be doing our next workshop, which is going to be harm reduction in the age of the pandemic. And this is a little bit of a changed kind of collaborative webinar from our previous schedule that we had made kind of pre-COVID, looking at harm reduction and hosting a book talk by Professor Nancy Campbell, who's going to talk about her book, OD and the Politics of Naloxone. So we're going to kind of change it up a little bit, still have her do a historical overview of the OD kind of crisis, its history, as well as the rise of naloxone and really kind of this community-powered mutual aid network. But then also kind of look at this idea of that even within this crisis, there are multiple crises going on, as well as kind of these overarching crises, this upcoming economic crisis that is probably about to hit us, as well as obviously the climate crisis. And so how do we think about crises within crises? And so maybe looking specifically at the opiate crisis, as well as the historical mutual aid networks that have arisen from that, that were not supported by the government. And have only recently been so. So that'll be on May 5th. And if you sign up, we'll send you some emails, as well as go to the Sanctuary website for all kind of COVID related stuff around the Health Autonomy Clinic. And then lastly, if you're able to in these times, please donate to the Sanctuary for Independent Media, which has been a great space for 15 years now. And like all other organizations across the country, is always going to be suffering in kind of this capitalist economy. So we need your support. So please go to just the website, and you'll see at the top tab to the right, there's a donate button.